everybody, and welcome to Mouth Matters Open and Honest Conversations about oral cancer. Today, our final episode for the Mouth Cancer Foundation. Our special guest is Lorraine Grover. She is a nurse and an expert in helping patients regain a healthy, intimate relationship with their partners. So, Lorraine, welcome and tell us how you got started.
Oh, thank you, Eva, for that introduction. Yep, I used to be an A&E sister, or ER, as you call it in the States. Had a baby, didn't want to work full time. I was teaching trauma, and I met a urologist, and he offered me a job, saying I must have seen loads of penises being a casualty sister. And I was mortified. I had this baby in a baby pouch. I was in a suit, and just thought, no, I didn't see many penises. Felt embarrassed. And the job was mine. And it ended up being 1 day clinical, 1 day research. And the research day was trying out tablets, giving out tablets to patients. And they were talking to me about their sex life. And again, I was a bit tongue-tied. I felt awkward. The name of the tablet came about and it was Viagra. So it was revolutionary. And
So you got very good at working with men. Now, how about the women in their lives, and how about women, cancer survivors?
yeah, that's a great question, actually. So when I was seeing the chaps with their prostate cancer, I was asking the partner if they were female, because I was seeing same-sex and heterosexual, about their sexual well-being. And they were really surprised that I was. Well, actually, sex can be a together thing, and it's really important. You ask the partner, and it really worked out that for a lot of them, they were having their own ill health, whether it was the menopause or it was breast cancer. So it was really important that we address the couple. And I got more and more comfortable talking to women about their sex
I
lives
was
too.
never asked about my intimate relationship and how oral cancer affected it.
Wow.
Never. And
That's
so I
in,
think that
yeah,
it's brilliant. And I hope that lots of hospitals begin to offer the kinds of
fantastic.
services that you offer.
Yeah. Had one moment at a Christmas party, drinking a cocktail, met an ENT surgeon, and just chatting about my job. And I said, how do patients that you operate on, how does that impact them kissing? And he sort of looked at me and walked away, and I remember then thinking, there must be a huge impact on intimacy for lots of people. So I'm great we're here chatting today.
Without a doubt. I mean, oral cancer survivors particularly often have some facial disfigurement. So kissing might be a lot different.
And
And
yeah,
it must be
oh,
hard, for some people.
yeah, and I think permission giving is really important. So I often talk about the brain is the biggest sex organ.
That's what we want to hear about. How can
Yeah,
we get to that place of a
brilliant.
great relationship?
So we can bring that into genitalia, whether you've got a vulva, you've got a penis, and communication's important. That looks like an aubergine or an eggplant, but it's the emoji for a penis. And we need to communicate to get that intimacy back started again.
So it all starts in the brain.
Absolutely. 100%. Remember that.
People have a very difficult time, even if they're not patients, talking
Correct.
about their relationship. So now you put cancer into it. How do
Yeah.
we do that, Lorraine?
Yeah. Yeah. I think sometimes it's being able to talk about their emotional feelings, because I think everyone looks at a disease, they look at the pathology, they don't look at the whole person. So being able to communicate about talking, now I appreciate some people can't talk. However, it is. This is a light board. And I got this because I have met people. I've been speaking to people with mouth cancers, and difficulty in speech can be a big part of it. So how do you communicate with a partner? Maybe you need to write something down. This is something you can write, you can wipe off. You can write whatever language you want that to say. And it might not be kissing. It might be a hug. It might be sitting on the sofa, watching a movie together, or going to the cinema, because those simple things we forget about in the whole humdrum of a cancer diagnosis and the pathways of treatment. So communication is absolutely imperative. And talking about how you are feeling to share, because sometimes as patients, and I have been a patient myself, we have our own worries and anxieties, thinking our partner's thinking the same, but they may not necessarily be so. So something that you find worrisome bothersome. It might be you've got altered looks to your face, and that may impact on your sexual self.
Without
Your,
a doubt.
exactly, your partner actually fell in love with the person you are, the music you liked,
Yeah,
you know,
it's easy
the
to
things
forget
you
that,
did
right?
together. And actually,
Mm.
you can be in it together. And I appreciate it can be the elephant in the room. But actually, if you don't communicate about your feelings with each other, or write it down, or text each other, or whatever forum you find, write a letter to each other about how you're feeling since this, you might feel lost and abandoned. So
Right.
the
Those are really nice
communication is
ideas. I
important.
remember I had a friend who had a feeding tube. So she always had a tube coming out of her abdomen area. And she said that she would use it and she'd swing it around to sort of attract her husband and give him the hint that, it was a
It
good
was safe.
time for her.
Yeah, yeah. So I think you're right. The skin is a massive erogenous zone. We've got lots of nerve endings. We like how it feels. So it might be having a nice massage and actually getting our endorphins going with feel good factors, puts us in the right mood. Clothing we wear. We might not like certain parts. If you've had surgery, scar sites around the upper neck area, it might be you'll focus more on breasts or chests or bottoms. And I went to a strip lesson once, and I went to empower myself more to share with patients to understand how could something that's been around for centuries or burlesque maybe help us all and in ill health. And it was absolutely fascinating because it can be a bit of a tease, showing a shoulder, showing a back, hands, kissing hands. There are lots of ways that we can bring intimacy into the forum that might be different from what we've been used to. And sometimes even things like kissing change, don't they? People might say, actually, we'd stopped kissing passionately. There was no tongues, there was no intimate kissing. It changed over the years and it became more a peck on the forehead or the cheek. So actually, we might think we're missing this amazing sex life. But if you take a reflection, was it amazing? Did we get wrapped up thinking it was? And there'd been some change anyway. So it's like a new chapter sometimes, this diagnosis, speaking to someone who's able to help around sexual well-being and intimacy. I call it recovery and discovery. You're recovering from your diagnosis, treatment. Just having the diagnosis has an impact on our libido often. That sometimes we've then got to discover going forward how we can change that and what we can bring in.
Are there any questions? Put it in the chat if you have them. I have a question though about decreased libido when you are a cancer survivor. What do you do about that?
Yeah, and sometimes it can be things like fatigue, that decreased libido can be absolutely exhausting. That the whole thought of anything intimate is you're just totally gone. Your energy level is spent. So looking at when you may be at a higher level, even if it's a small bit, and being able to talk about that. What does that low libido mean for you? I like using a scale of 0 to 10. 0, I've got no libido. 10, high. I might be 4 and my partner might be 6, or you can switch it around. So actually, again, it's finding out what level that level of intimacy is to raise libido. It may not be about vaginal penetration. It may be about intimacy. And I think intimacy and sexual well-being, pleasure, fun, they are things that people enjoy. And it may not be you're thinking about penetrative sex, whether
Right.
that's vaginally or oral sex or anal sex, because sex play varies. There are lots of myths and misconceptions around it.
So, Lorraine, did you ever have a moment with a patient in a therapy session where the patient was like, had an aha moment that is so wise? Is there a piece of wisdom that you can share with us cancer survivors? A real good, strong, powerful takeaway.
I think definitely having a partner with you if you're in a relationship and you're not single, because it's just amazing how, if you take a partner along, it can open up a completely different dialogue. and help to demystify some of the myths that you're worried about. So that's one big thing. I can't talk enough about communication in whatever form it is. The wetter the better, I'll often say to patients. And actually, people identify with that, whatever age you are. Our genitalia needs to be lubricated and be well. And I think, again, normalizing sexual arousal can change over time, how our bodies respond to things. Patients often say they're not given any sex education in life anyway. So
Right.
that big take home for me has been, I will talk about the anatomy. I will use models. I will talk about sexual arousal circuitry. And it's amazing the number of people who will say, I have no idea what happens to get aroused in the first place. So that's one big thing. Shame and taboo definitely are often in the clinical route. So I have to normalize that. So I can pick up in a room often when there is shame and taboo. People look down, they don't want to look at me, they're a bit tongue-tied in the words, like I was when I got my job. So I'll get people thinking about what can we do to bring in that communication there. This is a little box which I think is quite fun, because people say, I don't know how to talk dirty, I don't know how to talk sexually. And I'll go, there are things around to help you. This is a little box that I got. You can make your own little things. Let's look at this one envelope. This is a new envelope, unsealed. Let's open it. And I've got a book I want to show you as well. So this is a little envelope. I dare you to write the sexiest personal ad you can come up with in 25 words or less. Now, isn't that just gets people thinking in a sexual way? I think nowadays AI is used a lot. You might even want to do that if you want and put some little things in. But that's the way that you can actually get a coffee, let's have a coffee. We'll open this up, or a glass of wine, and let's just talk about what that means.
What about for those people who are dating, for those people who don't have a partner and they're feeling very self-conscious about the surgery that they've had, about their capabilities have changed in the sexual arena? So how do you build someone's confidence?
From within themselves. Yeah,
Yes. How do you do
our
that?
our senses, sight, smell, sound, taste, touch. So smell's one big evocative one. The perfume, the aftershave you put on when you wash, the smell that makes you feel good. Start off with that. Script, write down what you would say to somebody, what you might actually put on your profile, so that you practice it, you get used to it, because you can still be your sexual self. You may want to share that you've had surgery, you've had a cancer diagnosis, you may want to do that, or you may not want to, but at some point, the communication is important to do so. And I think people don't give themselves enough positivity about themselves sexually, how they look, even from underwear. The underwear that you wear underneath your clothing, no one may see. But think about what makes you feel good in your underwear. Maybe this is the time to go off and get yourself measured for a bra or some sexy underwear, or you guys get some nice silky underpants, and it's gone of the cotton scratchy ones, that you actually give yourself permission to be your sexual self. Learn about that. Actually explore it yourself with those senses. Our sight, what makes you feel good in what you're wearing? And think about parts of your body that you're happy about. It might be your breasts, it might be your bottom, legs, hands. There are parts of our anatomy that we forget about when we have got disease to a particular area of our body. So getting your
So we
sexual
should
self.
think about what do we love about ourselves? What do we think is really
100%.
attractive
Yeah.
about ourselves, and then build on that.
And sex play, masturbation, self-play, self-pleasure. It's all about how is your body going to respond sexually since you've had your diagnosis or your treatment. And sometimes it might be having a look in the mirror. Having a look in the mirror, gently bring it in. How does it look? It might be opening your mouth to have a look. There are, starting to just gently feel what's comfortable for you, rather than hide away from that, to actually work out your genitalia. Do you remember what I was saying about our brain? And it links in with our genitalia to get aroused. So our sex play for arousal might be different. We may not be using our face as much. We may not be using our mouth, but we could caress an arm. We could caress ourselves when we come out of a shower or a bath, or get dry with a towel. How does our body respond? Bring in fantasy. This is a great book I love, Want, by the actress Gillian Anderson, and it's fantasies from around the world. I get everyone reading it because sometimes we need to feel empowered to have thoughts about sex and to think sexually without cultural shame and taboo. And that gets us feeling about our sexual self as well. How does our body respond? Using lubrication, lots of lubricants around. There's some real cool ones, nice coloured, silicone ones, stay wetter longer. They don't dry out like water soluble. I talk
So,
about
Lorraine,
women.
if a cancer survivor wants to have a session with you, can you do online sessions with them in the UK?
Yes, yeah. That's become quite popular actually since COVID. So yeah, online happen. And actually, I was always a bit apprehensive about online appointments. But actually, what's brilliant is patients can be relaxed. They haven't had to travel somewhere. They're not stressed. There can be a partner. It might be easy
Right.
to have the consultation. And as long as they feel safe, they're not overheard, they can open up about how they're feeling. It can work really well. And in my clinic setting, I've got a trolley with my sex toys in, a whole variety of them.
Mm.
Here,
So
I've got a whole room.
I have one last question for you, Lorraine, and it's a personal question. But did you yourself, you talked about the senses and bringing our senses to the forefront and paying attention to how our senses react in a sexual way. So, my question for you is, have you yourself had an issue with any of your senses and your sexuality and learned from it to become a better therapist?
I have actually. I got spinal tumour in my spinal canal in 22, and I had to have it removed, major neurosurgery. And as I came around from the surgery and the surgeons came to see me, there was, how are you? And I was laying flat bed rest for 4 days. And I actually went, do you know what? I'm not paralyzed and I can feel my clitoris. And they didn't know where to look. And I was like overjoyed, you know. And so they looked at me and I went, do you know what? You mentioned sexual dysfunction, a one liner in my consent form, but you've had no more since discussion. So I thought I'd share that with you. And I have altered sensation from around the back. So I don't feel properly and a little bit around my breast. And so that's made me a much more, I feel, empathetic clinician because I have experienced, I know what that feels like, and being told you'll be fine in 3 months. Really? You know, there is no time frame. It varies for everybody.
We didn't speak about the sense of hearing. Could you speak
Oh, yeah. I wear hearing aids. Actually, that was another thing pre-op. I had it all over on bits of paper. I cannot hear very well, and my hearing aids are out in the anaesthetic room. You're right. So to get aroused, I need to hear. So I've learned that I saw a young deaf gentleman years ago with a signer. And I spent an hour in the clinic with him, and we talked about safe sex, and he had erectile dysfunction. I now know, looking back, I feel I could have added more to that consultation, even though at the time I did the best I could, and the patient and the signer were thrilled because they'd never had a discussion like it. So I've
Hmm,
learned again about hearing loss and the impact of that.
right.
Um, and
So
yeah,
hearing the nice things someone might say to you,
yeah.
hearing the moaning or the sounds of pleasure can
Eva,
make
you're
a
doing
difference.
great. You're picking
There's
up the sex therapy side of the senses and communicating. So again, if someone says, you know, I absolutely love your breasts and your hair, you might be bothered about the tongue's changed or you've got some scars, but actually, why not embrace and engage? Oh, this is great. This person is liking this part of my body, but I've been focused on this part. So you're
right.
absolutely right. Yeah,
So it's all
completely.
about, actually, it all comes back to the brain,
Yeah,
and how if we change the way we think, we can actually have a more fulfilling relationship with
yeah,
our partners.
yeah,
Lorraine,
exactly.
thank you so much for coming on our program today. I'd like to thank you all for joining. If you have any questions, you can actually put them in the YouTube link, and one of us will get back to you. And you can also find Lorraine's information if you are interested in having a private session with her. Thank you, everybody. And this concludes Mouth Matters, open and honest conversations about oral cancer. Goodbye, everybody.
Bye.
Thank you, Lorraine.